In video 5, we are going to discuss chin and cheeks, study the muscles and learn where the fat body of cheek is located and what is its impact on the shape of the face. Let's have a look at these photos of Bill Gates, Angelina Jolie, Lil Wayne and Justin Bieber. So make it grayscale and find all of the mastication muscles or masseter on these photos. So the mastication muscle or masseter starts from the zygomatic process of the maxilla. There. No, maxilla, it means upper jaw. This bone. Oh, sorry. No, yes, that bone. That. And goes along the edge of the zygomatic arch. There. Then it descends and attaches here to the surface of the mandible or lower jaw. Here attached. So, and this muscle lifts the lower jaw when we chew. You can grit your teeth and feel how it strains. So, the mastication muscle forms this volume. For some people it's greater, which makes the jaw widen here, non-regarding the volume of the bone. It means the angular size of mandible and how much it protrudes. Yes. If the mastication muscle is big, this place will be prominent. If it's small, this place will be small and the face narrow. So, look at this picture, please. This is the parotid gland, and this is the parotid duct. Here it goes through the buccinator muscle, and through it, through the parotid duct, the saliva flows into the mouth cavity, and its length is about 7 centimeters. These photos show the mastication muscles and the orbicular eye muscles. Let's mark this spot on all photos. Here, the mastication muscle is attached to the zygomatic process of maxilla. You can touch your face and find this spot on it. So now let's follow 4 lines that conventionally go from this cavity. Goes up along the lateral edge of orbicular eye muscle. Goes to the ear along the zygomatic arch. Goes to the internal eye angle along the lower edge of the eye orbicular muscle. And descends along the edge of the mastication muscle. So I don't want to follow it on other faces because you can stop this video and imagine how it goes. So now let's speak about the muscles in this area. They work when we smile, for example. and do like this, for example. This is the muscle that lifts the upper lip, or levator labii superioris. It rises from the maxilla, more precisely at the suborbital edge of the maxilla, goes down, some fibers are woven in the skin of the upper lip, some in the orbicular mouth muscle. So it lifts the upper lip. So this is the muscle that lifts the mouth corner, or levator angulioris. It's here a bit deeper, and it starts at the canine fossa below the infraorbital foramen, goes to the corner of the mouth and lifts it. So the major and the minor zygomatic muscles both start at the zygomatic bone. The lesser goes here and joins the orbicular mouth muscle and the skin, and the greater goes to the mouth corner. So in general, the better these muscles are developed, I mean all of that muscles developed, and the thicker is the layer of fibrofatty tissue under the skin in this area, the bigger is this volume. So, and it should be said that the growth of this volume on the one hand makes the nose visibly smaller because it protrudes less from that layer, and on the other hand, the growth of this volume somewhat hides the eyes. They become less prominent and seem smaller. Now let's have a look at the chin muscles. This is the depressor angulioris. It arises from the low jaw here. Then it goes upwards to the mouth corner, and it lowers the mouth corner. So on all of the picture it's blue. I show how it works. The next one, mentalis, is located here. It originates from the incisive fossa of the mandible, goes downwards and weaves into the skin of the chin. And it works. So let's find mentalis on all of the pictures. It's yellow. The next works like this. The skin of the chin is lifted up. Depressor labii inferioris arises from the mandible just in front of the mental foramen, where the anterior fibers of depressor angulioris cover it. Then it goes upwards and is woven into the orbicular mouth muscle here. It lowers the lower lip and pulls it laterally downwards. Lowers the lower lip, yes. and I show how it works. And it's located in between. And also, I am going to mark out all of the orbicularis oris muscles, and find these muscles on the photos with different facial expressions also. So let's see how does the shape change. Now let's discuss why a chin can be forked with a cleft in the middle. For example, like Demi Lovato's one. As you understand, the chin muscle, mentalis, consists of two bundles. And if you strain your depressor labia inferioris, here in the middle, you can feel a recess between the right and the left muscles of the chin. And the cleft is formed because there is a distance between the right and the left chin muscles. Well, I personally do not have such chin. My muscles stick together tightly, and when I strain them, I get a convexity, like a convexity, not a cavity. To feel that there are two of them, I need to strain my depressor labia inferioris, so there is no cleft on my chin. Now let's speak about platysma muscle. And first of all, I want to show you how it works. And yes, this is one of the mimic muscles. It looks like a wide blanket and it has three parts: mandibular, labial, and modiolus. All three parts arise from the superficial fascia of the upper chest, across the upper part of the pectoral and the deltoid muscle, and rise under the skin of the neck. The mandibular part is attached to the lower edge of the lower jaw. The labial part continues under the skin of the lower part of the face, where it comes close to the depressor angulioris and is attached to the skin of the lower lip.